Firstly, is Cardiotype Exercise, which is usually for body fat loss. So that's running or fast walking or cycling or a little bit of the work of swimming. So Cardiotype Exercise, and most of the over 50s I know that do exercise, they do some running. A lot of over 50s set themselves up to do a 5K in the morning, for example, like me and my wife. So that's exercise that a lot of over 50s do already, but far fewer of them go into the other types of exercise, which is resistance training, which is building up some of the muscles, generating some muscular strength, and also perhaps the area of flexibility or balance or mobility. That's another area that people lose a lot in their 50s and beyond, which very few over 50s actually work on that particular area because they haven't needed to. When you're in your 20s, you don't need work on flexibility and mobility and balance control because you're pretty good at that anyway, naturally. But that declines over the year as strength declines as well. So I would look at every over 50, I'd look at them individually, find out what they're like. Then if they're very skin and bones and low body fat, then I wouldn't give them a lot of cardio to do, but I'd think about some resistance training. Equally, if they're overly fat, I'd think of a program that was based with a lot of cardio, but also some muscle building as well. Muscle building is something that over 50s need a lot of, not because they're being vain, but to help them in their everyday lives, things that they do around the house, to enable them to live a more independent life as the years go on.
Is there anything they shouldn't do? Are there any warning signs where you think, hang on a second, this isn't for me, training people in the way you do?
The key thing is to build up very, very gradually, especially if you've not been used to exercise. And certainly most of my clients that come to me, they haven't been used to a lifetime of exercise. They've been used to, like I was, a lifetime of being a slob, basically. In that case, they need to build up very, very gradually. And the first few exercise sessions should be things well within their capability, and then increment gradually. So if I'm asking somebody to do, say, 10 minutes on a treadmill, the first week we'll do 10 minutes just walking on the treadmill. Next time we'll do 10 minutes fast walking. Then we'll drop in a minute's worth of jogging every 5 minutes into that 10 minutes and gradually build up.
Slow build up.
So an incremental build up. And the same thing goes when we go into the resistance world. So if we're talking about weight training or using machines in the gym, again, start off with weights that are well within the capability of the person and then gradually build up. So focus on the big muscle groups, the muscle groups that they're going to need, things that are going to help them as they get older and beyond that. Another interesting statistic, and talking about weight loss, is that of the people aged 70, those that are over 18 stone are likely to have less than 5 years life left. Those that are under 18 stone are likely to have 10, 15 or 20 years life left. And the other thing is that over 70s, once they get into over 18 stone, they're 70% likely to end their lives by riding around on a mobility scooter because they're unable to walk.
Sure. But it sounds, I mean, a large focus of your work is about the weight loss, weight management and strength building. But in terms of mental health and well-being, in terms of what the benefits are on that side in brief, what would you see, or what would you see in your clients in a sense that comes from participating in what you're suggesting?
A lot of the mental health benefits, I think, are not having the mental health disbenefits of being unfit. So that, for example, if you're very unfit, you're going to be. I know people who are overweight and they dread the thought of having to pick something up from the floor because they know that's a bit of a stretch. There's somebody 60, 65 years old, I know, he's 24 stone. He can't bend down and pick something up the floor. He dreads that happening. So the fact that you could do that without worrying about it is great. The fact that people can go to the shops without being assisted, being able to live independently as they wish, be able to go where they want to, maybe not. And that is all a big benefit. And the fact that people are able to live longer, to see more of life as the years progress, is a main fundamental mental benefit. And also being able to do what they want to do. For example, they can add new hobbies, add new interests, things that take them outside the house rather than becoming less independent, less mobile, and more housebound. All these things generate additional life to them. One of the phrases I use is if you get fit over 50 and maintain that level of fitness, it's firstly going to add years to your life, and it's going to add life to your years. You're going to enjoy those years a lot.
Quality. Yes,
so it's adding years to your life. That's the number going up, and adding quality, adding life to those years.
Right. Okay. Well, that's really interesting. Now, just to finish up, if people just want to try something at home or to do something to improve their health themselves just now, just because they want to do something today, what would you start them off on, like now, today?
Maybe 30 seconds on the spot jogging. I'm assuming that they're obviously people are fit and well to do this. You should obviously check your own health status first before taking on any exercise program, especially as you get up to 50 and beyond. But so 30 seconds on the spot jogging is a good way to start it. And as time goes on, maybe increase the time and maybe increase the range of motion. So start off with the knees coming up only a little way. But then as the time goes on, maybe increase the range of motion of those knees and increase the time for on the spot jog. Get the heart rate moving. That's going to help mobilize lots of things in the body. It's going to help mobilize body fat.
And obviously checking you're healthy and safe to do so from your doctor or other healthcare professional, just to check that everything's at least safe to proceed and monitor carefully.
Absolutely. And of course, the other side of this big coin is the nutrition side as well. So people got to think about eating healthily and at reasonable times. And if they are looking to lose weight, a key thing is to do that exercise, that 30 seconds building up to more of jogging on the spot, for example. Do that in the morning before having breakfast. That extends the overnight period of fat burning that the body uses.
Before the fasting, literally, the break fasting.
It's before you break your fast, yeah, exactly.
Yeah.
So I've looked at doing that, and maybe some simple resistance exercises as well. Maybe some against the wall push-ups. So rather than doing a full push-up or a press-up on the floor, do them against the floor. Then gradually, then you can progress to that to a lower level of angle. So as the body moves more and more horizontal, then the push-ups get harder and harder. So the next level of push-up is maybe against a desk or against the edge of a sofa, and eventually do a full push-up, maybe with the knees on the ground to start with. And the push-up's a great exercise. Exercise works all the push group muscles of the upper body. So work towards that as well.
Okay, well, that's really interesting and helpful. So thank you very much for having a chat today.